Our third track is eating disorders. And again, our eating disorders program is similar in that it, again, is very attachment oriented as its sort of underpinning model. So once you get symptom stability with an eating disorder, then we focus on the underlying individual conflicts, emotional problems, relational problems, so on and so forth.
Our eating disorders track is sometimes, I think, the one that is most complex. And the reason for that is that a lot of our clients have had previous treatment. They've been to residential treatment centers, even inpatient treatment centers for anorexia, for bulimia, for binge eating disorders. And they've had some relative success, meaning that for the time that they were in the program, they started to eat, they had weight gain, they stopped their throwing up, they stopped their binge eating. But what happens is after they leave, they have just a little bit of anorexia or they have a little bit of bulimia. And they then decide that they need it as a way of dealing with stress or the way of dealing with life. And the problem is that a little bit of anorexia will kill you because it's a progressive illness. And you need, once you use it, then you use it more. It's a little bit like doing drugs. If you're doing a little bit of cocaine and your life becomes stressful, you might start doing a lot of cocaine. And that can be really dangerous. So the idea that is you have to understand the function. Usually eating disorder is a way of avoiding dealing with life. Sometimes it's hard to feel. You want to numb yourself out. It's hard to remember. There are things that happened in your past you want to forget. Sometimes eating disorder is about just pretending, maintaining a false self, doing what you think other people want. I would say the engine for so much eating disorders is perfectionism. You want to be able to do everything perfectly and you don't want to disappoint other people. And when you have that, it's a characterological style. And you live in hell because you're always oriented towards, I'm an artist, but it's never good enough. I go to work and my boss is disappointed with me and I want to kill myself. And you live in a perpetual hell. And so the only way to be able to cope with that is using your eating disorder symptoms, which then keeps you numb and keeps you in avoidance. And so the goal is to give up those symptoms long enough to learn how to be able to deal with those situations without using your eating disorder, finding new tools to be able to cope with distress. But this is a long-term habit and pattern. Most people have been doing it since they're 11, 12, 13 years old. And so to be able to leave that behind is really a difficult situation. It usually takes longer treatment. And you need a team to be able to do it, because eating 3 meals a day, having a damn good dietitian, and monitoring that the person is working their program for a period of time to develop new habits allows them to be able to get in difficult situations and find new ways of dealing with it.